Hi, Christine Coral here, and welcome to Quieting Your Anxious Mind. And today's class is on relaxation. So, great topic, really good thing to work on. The reason why we cover relaxation in an anxiety class or a worrying class isn't so much because we want you to learn how to stop worrying using something external or that there's anything wrong with anxiety. One of the themes throughout this whole program has been learning that you can cope with anxiety, learning that you don't need to run away from it. However, for those of us who worry a lot, what happens is we get a lot of muscle tension. We tend to hold ourselves quite tightly, and it feels uncomfortable. And if we start the day out from a relaxed state, it kind of makes everything go a little bit smoother. So the point of this class isn't so much to teach you a technique to take away your anxiety, it's to take away some of the muscle tension associated with that anxiety. Does that make sense? I hope. Um, because we can live with anxiety, but why not live without some of the muscle tension? Because what happens is a lot of people will use this technique as a way to get rid of their anxiety, kind of like a medication that you might use to take away your anxiety. And sometimes, if you're really wound up, you can do a relaxation recording, listen to a relaxation recording over and over again, and still feel quite tense and tight. So the point of this is really, it's quite a nice thing to do, good thing to practice, good for all of us. And it is a skill, just like everything else that we've been covering throughout this program. It's a skill that you can learn to get better at and do more effectively. So here we go. So we're going to start really with controlled breathing as the first thing. Now, if I'm working with people who have panic attacks or panic disorder, one of the things I'll do is I'll teach them how not to breathe the first, and we'll actually hyperventilate and breathe in quite deeply, as long as it's safe for them to do that. And we'll bring on some of the symptoms of anxiety. So a lot of the symptoms that we have that we attribute to anxiety are often symptoms of hyperventilation or breathing in a little bit too much. So when you're breathing in properly, not chest breathing, more belly breathing, which is part of the controlled breathing that I'm going to show you, you tend to have the right balance of oxygen and carbon dioxide in your system. So if you have too much oxygen in your system from breathing in too deeply, what happens is you start to feel lightheaded and dizzy, and maybe even you have a little bit of an out-of-body experience. Your hands can tingle, you can get hot flashes, all kinds of symptoms that really do feel like anxiety. And of course, one of the things that everybody tells us to do when we're feeling nervous is to take a deep breath. But you do a few too many of those in a row, and you're going to start to hyperventilate. But even if you're breathing in just a little bit too much oxygen, then you're not going to feel quite right either. So what we're going to do is, I'm not going to show you how to breathe the wrong way today. I usually only do that with people in my office, and it works really well to teach people how not to be afraid of those symptoms and overcome a panic attack. But usually I like doing that sort of thing one-on-one, so I'm not going to do it online, but I'm going to show you the right way to breathe rather than how not to breathe today. So little breathing 101 before we get going. So when we do belly breathing, what we want to do is take a deep breath in and use up all the space that we have available in our lungs. So I'm kind of trying and draw this here. So here we've got, my bad drawing of a person here. So we've got the lungs. See, very quick. And so we have the lungs, and what we want to do is, when we're chest breathing, we're really only filling up the top part of the lungs, and we're not going any lower. What we want to do is fill up all the way down to the bottom of the lungs and then completely empty them back out again. So how we do this is we start to recruit our diaphragm muscle. So it's kind of a thin muscle that's just underneath our lungs here. It almost looks like a parachute. If we have a side view of somebody's lungs here, so this is a side view. There's the person's nose, head there, bad diagram. So here's the lungs, and it kind of almost goes like this over the organs. So it's a bit of a pear-shaped muscle. Maybe if you want a better diagram on this, then Google it. Look on images in Google to give you an idea. But it's the muscle that starts to contract when we have hiccups. And what we want to do is to be able to use that. So one way to feel your diaphragm is to put your hands, well, you can't see where my hands are, so I'll stand up a little bit more. I still can't. I'm going to be out of frame. But if you put your hands sort of under your breastbone, and right around where your stomach is, where you can kind of feel your ribs underneath your chest and the bottom of them, you should be able to feel your diaphragm when you go, and give it a good jolt. A speech language pathologist I know taught this to me once, so as a way of finding it. So just do a couple of good and when you do that kind of motion, you should feel it contract, and it should feel familiar because it's what you use when you have the hiccups. So we want to use the diaphragm. What happens is when we breathe diaphragmatically, if you've ever seen a baby breathe, their bellies go in and out, or up and down as their lungs fill with air. And what happens is the diaphragm starts to, where did I put my pen? My diaphragm, or our diaphragms, start to push down. You know, as the lungs fill up with air, they push down, and then our stomach starts to push out, and we get a nice big Buddha belly. So that's what we want when we're breathing, is to push all that out. So the quickest way to learn how to do this is actually to push all the air out of your lungs, and then that creates a bit of a vacuum. So the next breath in is automatically a diaphragmatic breath. So let's do that now. So let's push all the air out. Okay, did you feel that? Does that feel different? So when you push all the air out, you want to make sure you get every last little bit. So when you think you haven't quite, when you think you've breathed everything out, you want to just see if you can push a little bit more out. So let's do that one more time. And then the next breath in, your stomach should pop out. Okay, let's go. Okay, feel that? So if you didn't, pause this and practice a few times. You can put your hands on your stomach, and what we're really going for is that your stomach pushes out more than breathing from your chest. Usually when we're breathing from our chest, we're breathing very quickly. Anywhere like average respiration rate. So this is how many breaths, how many times you breathe in and out in a minute, is roughly about, 10 to 14 is average. But even then, you're still breathing fairly quickly. If you're breathing completely in and completely out, you're going to slow that down a lot more. So on average, every time I count this with people, my respiration rate is between 4 and 5 breaths per minute. And some nurses that I've done this with have said, well, that's not normal. But my oxygen, for nurses and doctors watching, my oxygen saturation is always at 100. So I'm breathing in, I'm breathing out completely. So you're not restricting your breath. It's not a shallow breath. So your blood should be completely oxygenated. So, but not over oxygenated. So that's the trick. So yes, when you're feeling anxious, you want to take a deep breath, but a long, slow, deep breath. Okay, not too quick. And what we're going to do too is breathe in for as long as we breathe out. A lot of times we'll take a deep breath in and then push it out a bit too quickly. So we're going to slow it down. Now, many of you may have seen a psychologist and been taught this before, and we're going to do something called the 4-part breath. Okay, and what we do with the 4-part breath is we breathe in for a count of 8 and hold for a count of 8 and out for a count of 8 and hold for a count of 8. So we're doing 4 parts to the breath. We're holding at the top and the bottom of the breath, and that really slows down our breathing. I usually tell people to do this if they're feeling really anxious and then they're making sure that they're not hyperventilating. So the thing too is a lot of different psychologists teach this slightly different ways, like breathe in for a count of 6 and out for a count of 4, or vice versa, or you're shorter in the holding. It doesn't really matter, or you count 1,000, 2, 1,000, 3, 1,000, 4, 1,000, and then hold for 4 1,000s. It doesn't really matter. The only reason why I kind of suggest 8 is a lot of people will count too quickly if they're feeling anxious, so it's just a way to slow it down a little bit. And when I say count 8, it's not 8 seconds. It's sort of like almost like more of a musical count. So let's show you what that is. And the other thing too, when you're breathing in for a count of 8, you're not filling your lungs up as fast as you can. You're pacing out your breath. So, if you have fairly good lung functioning, then you should be able to stretch the breath out so that you can reach a count of 8. Very rarely, like occasionally if, I'm working with a smoker, then, who's been smoking quite a bit, then their lung function might not be as good. And then we shorten it to 4 and work. Well, I'll do a smoking cessation video because it affects your breathing and also makes you feel more anxious too, because of all that nicotine and other things too. But that's another class. So if you need to adjust to a 4-part breath, 4-part breath, go ahead and do that. Do what feels comfortable. But when you're breathing, it's more about pacing out your breath so that you stretch it out for the full 8 counts. So usually I tell people, when you're breathing in, you don't want to go in 1, 2, 3, 4, 5, 6, 7, 8. You run out of room at the end of the breath. What you want to do is breathe in 2, 3, 4, 5, 6, 7, 8, and stretch it out. So let's do that together. You're going to count in your head. The other nice thing about doing this controlled breathing when you're counting is you're not thinking because you're busy focusing on your breath. So let's do this together. So, I'll count, you breathe, okay? So, ready and set and breathing in 2, 3, 4, 5, 6, 7, 8. Hold 2, 3, 4, 5, 6, 7, 8. Out 2, 3, 4, 5, 6, 7, 8. Hold 2, 3, 4, 5, 6, 7, 8. Piece of cake, right? Very easy, and it'll slow down and help slow down your breathing and help get the right amount of oxygen back into your bloodstream, which can take a few minutes to readjust if you've been hyperventilating and you're slowing down. Now, sorry, I'm not quite over that cold I had last time. So the next time you are feeling very kind of panicky and you think you might be hyperventilating, you can slow down your breathing by doing this and see if that takes the edge off a little bit. And then I always think it's a good idea to practice breathing diaphragmatically. It can feel very strange if you haven't been using those muscles much. A lot of people are kind of surprised to hear too that we tend to breathe normally at night when we're sleeping, that we use our diaphragms when we sleep. And you think about how the rate of breathing slows down, and if you have a partner who snores, you certainly hear how their rate of breathing slows down because you can't help but hear their breathing. And so what you'll see that you really do slow down at night. And when we were babies, we used to breathe properly, and somehow along the way, a lot of us forget how to do it, and you really want to be able to slow it down. So with the 4-part breath, you're going to do that. You're going to slow your breath down to 4 or 5 or less. If you're doing that, I think with me that would be closer to 2 or 3 breaths a minute, but of course getting enough oxygen. But what we're doing here is just slowing it down. But for the rest of the time when you're just practicing breathing, you can do a 2-part breath. Just to get your diaphragm muscle back in shape. So just breathe in for a count of 8 and breathe out for a count of 8. And do that, 10 minutes a day, or even twice a day if you're really keen. Now it feels odd to me. It took me a while to learn how to breathe properly again, but it feels odd to me when I don't. I kind of feel dizzy or off, and I know it right away, and I'm not a quick learner, but eventually you do start to notice what feels right, and your stomach muscles get used to using that diaphragm muscle again. So that's part one. So controlled breathing. So this is one of the first things. There's lots of different ways to relax, and one of the reasons why I start with controlled breathing, and a lot of psychologists will start with controlled breathing, is hyperventilation is just such a big component of anxiety, and so it's a good way to slow things down and learn how to get there. And I just lost my place here. Okay, so the next relaxation technique I'm going to show you is something called progressive muscle relaxation, and it's the second one I usually teach to people if we have time to spend on this in sessions, because it's just an easier one. You can use things like hypnosis can be very relaxing. Imagery can be relaxing. There's another kind of relaxation called autogenic training, where you or auto-suggestion, where you say, oh, your shoulders feel warm and heavy, your arms feel warm and heavy, as kind of there's lots of different ways. And there's no end of relaxation recordings out there. I haven't found one that everybody likes. I'm going to make another quick one just to go along with this video. I'm just going to give you the instructions now, and I'll make an MP3. I might have to wait till my voice is a little bit better, but what happens is everybody has a preference for different kinds of voices, and so I think you really have to listen to them. If you go onto iTunes or can listen online before you buy, that can be a good way to do it. Mine will be free, but if you want to try out a few other ones, go ahead. There's different bookstores, like there's a bookstore here where I live, Self Connection Books. I do a lot of workshops there. And they have a listening room, and you can go in and listen to your recordings, recorded CDs before you buy them. And that way you can make sure you actually like the person's voice. So it's more a matter of preference, I think, for a lot of guided relaxation CDs. I mean, ultimately, you want to be able to do this without a CD. That's my preference, actually, is that you learn how to do this on your own, and you don't have to worry about whether you have it there or not, or whether, you can do it when in the middle of a lecture or a meeting and nobody really knows what you're doing. You can kind of do it. Well, some of the facial things today I'm going to show you, no. But other ways, you can kind of gently tense and relax and let go of tension as you go. So, but why I start with progressive muscle relaxation, for a number of reasons. One, it teaches you where you hold your tension. And so you feel it. Like when we have anxiety, we tend to brace ourselves for what's coming. We're bracing ourselves for a fight. And, I get a lot of tension in my shoulders and in my jaws, another common culprit. Well, for me too. Actually, could use a little massage too. Massage is great. Love massage, but can't always get that on demand. Or for tension in our foreheads or wherever it is that we carry it. So what we do with progressive muscle relaxation is we tense and relax the muscles. And so we learn to recognize tension as it comes up, and hopefully throughout the day be more aware of where we're holding our tension in our bodies. So we're going to tense and relax. And then the other thing that it kind of does, which is good when you're beginning to practice relaxation, is when we tense the muscle and then relax it, we relax a little bit more deeply than if we just try and let go of the tension. So it makes it a little bit easier, I think, to start. And as you get better with relaxation, you should be able to reach a point where you can just go, oh, I've got tension. Okay, let go. And then you can let go of the tension, but it does take some practice. So the more you practice, the better you'll get at this. So, and then you can over time abbreviate it. We're gonna go muscle group by muscle group, and then what you can do is do both sides at once, or all upper body and all lower body at once if you want, if you're really keen. And you can do like a 2-minute relaxation to let go of tension. So you're gonna adapt this over time. You can abbreviate it depending on the situation. And so that's one other reason why it's a good one to start with. So what we're going to do is, I want you to just, before we start, or before you start any relaxation session, sometimes it's helpful to keep a little diary so you can see your progress. I think, you notice I do a lot of little things where you can keep a diary just so that you feel, you see the progress that you're making. So You can have the date or time here, and you can rate tension before and tension after. Really simple. We usually just do something simple like this. So, if you're feeling your tension, you'd say it was a 7 out of 10 before you started the relaxation session, and it was 3 out of 10 after. And you see over weeks, just the progress that you made. That can kind of be encouraging. So just something really simple. You don't have to get into too much detail. I mean, if you want to go what was happening at that time, or get more fancy with it, you can go ahead. But, do that for a few weeks and you see your progress and how much less tension you have over time. Okay, and then what we want to do is not tense too hard. So let's just put a few guidelines down. Don't tense too hard. What we're going for is just a gentle tension. You're not trying to squeeze and do as much tension as possible. You can give yourself a muscle cramp, particularly when we get to the legs. You give yourself a Charlie horse, and that's no fun. So just a gentle tension, and then relax. We can go to the shoulder, just a gentle tension, and relax. Your forehead, you just raise your eyebrows up, and gentle tension, and relax. You don't go all out, okay? You don't want cramps. Okay, and then if you have an injury, just relax that area of the body. Okay, so if you have an injury, say you hurt your shoulder on that part, you just keep your shoulder down and see if you can let go of tension in that area. If I hurt my arm, I wouldn't really tense. I just try and let go of tension, and no injury. And then also, if you're pregnant, I used to work on a maternity ward. That's where I did a lot of my training, was on a maternity ward. And just told everyone there, don't contract your stomach. I don't know that I could when I was near the end of my pregnancies with my daughters, but the abs were gone. I had to do a lot of core after. Boy. But no, you don't want to contract your stomach. Just relax in that area of the stomach. So you don't want to do too much tension there. So just use good judgment. If you have any physical conditions that might interfere, then, just relax in that area and you can follow along. And just imagine that the relaxation is spreading throughout to that part of the body. Okay? And what you can do is make sure that you have a quiet environment, if that's possible. I mean, in my house, if I waited for it to be quiet, like podcasts are a real challenge. I've got a mic that filters out some of the outside noise, but occasionally there's kids screaming. It's never perfectly quiet in here, so you can learn how to relax under less than ideal conditions. And as you get better doing the relaxation, that will be easier for you to do too. But a lot of us can't wait until that happens, or if we wait until kids are asleep, then and we do relaxation, we don't make it till we finish the whole exercise. We're out cold too if we relax a little bit. Well, if you have insomnia, that's not a bad thing. And so you want a quiet environment. A lot of people ask me about best time of day. That depends on your schedule, really. We want to get good at using relaxation throughout the day, not just as a tool to fall asleep. So it can be nice to do it at bedtime. Nothing wrong with that. However, if you fall asleep, you don't go through the whole relaxation exercise. So you can do it whether you do it morning, night, whenever you have 5 minutes. Some people need to schedule it in because their schedules are so busy, so that they need to find, a point in time where they can do this. Maybe they close their office door and do it in their office for 10 minutes. Or, it needs to be the same time every day. That's just like exercise. Some people will stick to an exercise program if they work out, at 6 a.m. every morning. So that's up to you. Time of day is completely up to you. And so let's get going with this. So what we're going to do is I'm going to show you how to tense and relax the different muscle groups, and I'm going to make an audio recording that you can download and put on your iPod. There are others. If you Google progressive muscle relaxation, you'll find other people who've put their voices up if my voice is annoying. I will put this up if you're watching this when I release the video. I'm going to put this up probably in a week or so. If you're watching this later than that, it'll already be up there with the class. But I'll put an MP3 up to download, and I have to find a nice quiet time too to do it and give my voice a little bit of a chance to recover, so I don't sound annoying and scratchy. So I'm going to just give you the instructions though now, so that when you listen to the recording, you won't wonder what the heck it is I'm talking about. So this is how I usually teach it in my office too. So we're going to start going through different muscle groups, tensing and relaxing the muscles. And what I'll have you do is we're going to do right side, left side. And then if you want later on, when you practice on your own without a recording, you won't need to, you can do both sides at the same time if you want. That's not a big deal. So for the hand, for the forearm and the hand, what you're going to do is make a fist, gentle fist, and you should feel tension up your forearm. And you want to keep the rest of your body relaxed, so you're not recruiting the muscles in your upper arm, just in your forearm. And so you hold and you hold and you hold, and then you relax and let the tension go. Now for your upper arm, you can tense this a couple of ways. You can bend at the elbow, and now you're going to keep your hand relaxed because you're not going to tense the muscles in your arm. We're just going to isolate the biceps and the triceps up here. So you're going to tense your upper arm. So you can do it by just bending at the elbow. I have it in my side. Or you can take your elbow and push it into your side. So if you push your elbow into your side, that can create tension too. And if you have a chair, which my arm rests are too low on this chair, you have a chair with an armrest, you can push your elbow against the armrest. So if I have a chair here and I'm pushing against it, that will create tension up there. So there's a couple of options too. However you want to create tension, bending at the elbow, pressing into your side, or pressing your elbow into the side of a chair. Okay, so I've got golfer's elbow, oddly enough, from drawing too much. So that felt very uncomfortable when I pressed into my side. So adjust it as you need to. Okay, see there, I've got the injury too. All right, so that's lower arm, upper arm, and then we go to forehead. And so for the forehead, we just raise our eyebrows up. And you see you get wrinkles in the forehead. This camera is very kind, but when I relax my brow, you still kind of see some lines there. I'm not going to go to get any fillers or anything, but you can see, where your lines are up in your forehead. So you want to put your eyebrows up and hold that tension there, and then relax. And then for your eyes and nose, you scrunch and hold the tension and relax. And then next is my favorite, everybody's favorite when we do this in a group, and I'm doing this on YouTube, so don't be shy. So, although you'll be at home alone, so nobody will be watching you. So, we're going to create tension in the jaw. Really important because so many of us feel tension here. Again, not too tense, not too tight, okay? But we're going to clench our teeth and stretch your neck. So, you can try these with me too, just so you get a feel of it. So, it feels a little bit more like second nature when you actually do it. So let's do it now. So see, I'm clenching my teeth, and see how I stretch my neck here? Beautiful, huh? So just going like that. And hold, and then you're going to relax and let go of the tension in the jaw. And it feels great, actually, to do that and let go of all that tension there. And give yourself a little massage, too. Okay. And then shoulders, you can create tension here a couple of ways. You can either pinch your shoulders up, bring them up to your ears, or you can pinch them back. Actually, both feel good. I think I've been hunched over too much today. Okay, so either way, whatever you want. And then for your chest, what we do is you're going to take a deep breath in and hold and hold and hold and relax. So you do a diaphragmatic breath, of course, now that you know how to do it. But for that, we're just creating tension because a lot of times when we are feeling anxious, we hold our breath and gulp. And so you want to have an awareness, create an awareness of what that feels like. So you want to be able to do that. Okay, next is your stomach. So if you're pregnant, no clenching your belly, or I guess if you've had abdominal surgery or any other thing going on there. But, we hold a lot of tension in our stomachs, and, they can feel off. We get butterflies in there. We're sucking our stomachs in a lot. So what you're going to do to create tension here is to suck your stomach in, just like you're on the beach. Hold it, hold it, hold it, and relax. And just let your stomach hang out like a big Buddha belly. Okay, and now for the legs, you can't see where I'm sitting, but there's not much to see anyway when we do the butt and thighs. So what you're going to try and do is isolate right side, left side. Is really fun when we're trying to clench the right side on the left side. So let's see. I'm going to just draw a stick guy here. Oops. So we've got a stick guy sitting in a chair. I'm drawing this I can't even draw a stick guy tonight. Okay, so we got the stick guy in the chair. And I should probably make him a different color, but oh well. And so what happens is you're trying to isolate just the right buttock and thigh right here. And you do that it's a really small movement. This is why even if you could see, you wouldn't be able to see much. You just kind of clench the right side. You will get better at isolating one side and then the other side. What happens when most people begin is both sides, both cheeks get clenched. We just clench one cheek and one thigh. And try to keep the rest of the body relaxed. So really, really small movement. Okay? Now, next, we're going to do the shin, or just create tension here. So what we do when you're sitting in your chair is you raise your foot up, okay? Just like that. Just point your toe up to the ceiling, and you'll just feel a little bit of tension across the front of your leg. You just hold that, and then relax, okay? So I was actually doing it while we're talking. Okay, and not that you could see, but oh well. It's more convincing if I really do it. And then for the clenching, this is the one where you want to be really careful because you don't want to give yourself a Charlie horse. You want to point your toe down, just like a ballerina. Point your toe down. And very gently, not as hard as you can, but you should feel your calf muscle tense up when you point your toe down. Okay? All right, and that's it. That's all we're going to do. That's the whole body. So we go through and tense and release the tension in all those different muscle groups. I will have a recording that you can follow, but even if you just do this without a recording, you tense and relax and tense and relax, and it'll feel great. Eventually, sometimes you're going to do this a few times, right? Because it is something that you have to learn and get better at, and keep your record and practice your breathing. And over the course of the next few months, I should get other kinds of relaxation videos up as well to give you some idea of some of the other techniques that there are. But these are my two favorite to start with. And again, I think most cognitive psychologists, we start with these two just because they are a little bit easier, and it is easier to let go of tension using these two. And certainly I'm going to have the meditation class coming up as well, which is, well, you'll learn in that class the point of meditation isn't so much to relax, it's just to be present with what is happening in that moment and learn how to focus in the present moment by picking an object to focus on, like your breath. So it's a little bit different than relaxation, but one of the side effects of meditation can be relaxation. So that'll definitely be the next thing that we'll have up on Wired to Worry. So, hope you enjoyed this, and I'm going to finish up the next class right away and have them both up online. So, I'll see you right away with the final class for the Quieting Your Anxious Mind series. Take care.